Nursing is a very hectic job, so don't let it be a case where you see people walking around with their standing cup in the hospital and they're looking cute and the clothes all well tucked in and everybody just seem like, they're working around a desk. No, nursing is not all about that. It's a field that it requires a lot of long-standing and a lot of hard work, hard labor, manpower. There's so much of that involved in nursing, but everybody entitled to their 30 minutes break or 15 minutes break, or if you're in Jamaica, 1 hour break. All right, so I know a lot of times, when we graduate from nursing school, we tend to be a little bit excited to start working because that is just something that you dream about, that is something that you always wanted to do. And I'm gonna just kind of give you a few tips that will help you with starting your nursing journey or your career. So first thing you want to do is that a lot of times people don't really tell you about your first experience, what your first experience is going to be like. So hopefully these tips will help you to survive your new job, your new role when you're entering the field. All right, so one thing I always tell people to do is make sure you ask a lot of questions even when you think that question don't make any sense, or it is a stupid questions, as sometimes we would normally say. So first thing you want to do is make sure you're asking a lot of questions. Ask questions, even if the questions seem as though it is quote unquote stupid to you. Go ahead and ask it, because I'm sure there is one or two other person who was thinking something similar along that line and is scared to ask the same question that you're thinking is a stupid question. So if you feel as though it is a stupid question, still go ahead and ask it, because you don't know who you might be helping. You understand? I want to make sure that you're very clear on the expectations or whatever is being discussed. You want to make sure that you understand, the assignment. Another thing is that you want to find a bestie. Find a work bestie, because sometimes when you have somebody to hang out with, it kind of helps with your whole transition or the process of, orientation. So find a work bestie, so that way, in the event that you have any questions, any concerns, you can always start with that person. So that way, it's a little bit easier for you with the transition. A lot of persons might go ahead and laugh at you if you have a little paper writing down certain things, because you're thinking that, oh, you're a nurse now and you should remember everything. No, don't be scared to do that. Get a paper or get a notepad and go ahead and write down information that is very important. So one thing that you definitely want to do is stay organized. And in order for you to stay organized, you have to have some plan in place. The last thing you want is for you to have a patient that codes on you, die on you, or crash on you. You understand? Because you're not organized enough to understand that this patient is priority or this patient needs to be seen now. So go ahead and find some notebook or something, get a notepad and write down information. When you get in a report, go ahead and write down information, so that way you can know what is needed to be done now and what needs to be done next, or something that will just keep you organized throughout the day. Nursing is a very hectic job, so don't let it be a case where you see people walking around with their standing cup in the hospital and they're looking cute and the clothes all well tucked in and everybody just seem like they're working around a desk. No, nursing is not all about that. It's a field that it requires a lot of long-standing and a lot of hard work, hard labor, manpower. There's so much of that involved in nursing. Even if it's a case where you're tired, you want it to be a case where you're still organized, you're prioritizing, and you're making sure that, whatever is happening on the floor, it's not affecting the patient and it's not affecting your license because of something that you totally had forgotten to do. Another thing that you definitely want to do is make sure you're taking your breaks. Everybody deserves a break. Whether or not you're saving life or not, you need break. Because if you don't take a break, there's no way for you to actually have good brain function. You understand? There's no way for you to actually be thinking properly, because can you imagine just working constantly and you're just feeling so exhausted and tired? Your brain is going to slow down, and when your brain is slowed down or you're feeling tired, you're going to be more prone to making mistakes, and that is something that you definitely don't want. You don't want to be making mistakes in the medical field or in nursing or as a doctor, surgeon, whatever area you're practicing in. When it comes down to life, mistakes are not something that you want to think about or you want to get yourself tied up in, because when you make a mistake, you have to think about a life that is being affected. So it doesn't matter if the break is 5 minutes, go ahead and just step away from the environment. But everybody entitled to their 30 minutes break or 15 minutes break, or if you're in Jamaica, 1 hour break. All right, but definitely go ahead and make sure you're getting your break, because it's very important for you to take those breaks, because those breaks, your bladder need a little rest, your brain need a little rest, your mouth need a little rest, like your ears need a little rest, your eye need a little rest. You need something to totally, change everything that is going on. You want to be outside of the department sometimes because you're tired of seeing people dying. You're tired of seeing people, just being sick. So you need a little time away from the work environment sometimes to just kind of, take a deep breath, try and forget about some of the patients that are dying. Focus on you for a little bit. Put on a little bit of makeup, lip gloss, drink little water. Keep yourself hydrated. Empty your bladder. Whatever it is that is going to make you feel a little bit refreshed. And then you can go back in and, deal with all the stress and the drama of the hospital. And you take your break when you can. You understand? And it's not a matter of when you can. You must take a break. You understand? They must find somebody to go ahead and cover. I know a lot of times it might be impossible to do so because some hospitals are just stingy with their money. They don't want to pay nurses, or they don't want to pay extra nurses to come in and do relief for persons. But definitely, advocate for yourself and talk up for yourself and find somebody to cover you, and let your boss know that you definitely need to take your break, because break is very important and you need it for, brain functioning. You have some people who are having like bladder infections and all of those things going on. People passing out at work. You don't want it to be a case where you are in that, 1%. When it comes on to you starting out your job, you're going to be prone to making mistakes. Everybody make mistakes in the first part. You understand? And as long as the mistake is not something that is causing any harm to any patient or to yourself, you understand, or to your license, it's okay to make mistakes. Because it's through mistakes you actually learn, you build, you get stronger. So you're going to be making mistakes in the first part of your career. Everybody do make 1 or 2 mistakes, but you just have to learn from it. So if you make a mistake, just go in one corner and just bawl. If you feel as though you want to cry, just go into a corner and just bawl. You understand? It's okay. It's okay to cry during those situations, because remember, you're new to this field, you are stressed, you are tired, you're making mistakes, and you feel as though because you're a new nurse, not supposed to be making mistakes, because every information up here is supposed to be fresh and it is supposed to be just flowing, and so you find yourself feeling overwhelmed. Yes, you're gonna be feeling like that. It's okay for you to feel like that in the first phase, you understand? But use that as a stepping stone to make you a little bit stronger. Persons are going to be there critiquing you. You're going to feel upset. You're going to feel sad. You're going to feel as though, nursing's not the field for you anymore because you don't like the critiques or the comments that some persons are going to be, telling you. But you just have to understand that, persons are just looking out for you as well. So if you make a mistake and somebody correct you, it is constructive criticism, and it is also something that is the correct thing to do, because it doesn't make sense you're making a mistake and nobody not correcting you, and you keep on doing the same thing, and then you feel as though you are, doing this thing and you're a pro at it, but you're doing a bunch of foolishness out there. You're doing inaccurate things out there because of someone not telling you what you are doing is incorrect. Do make a mistake, just go ahead and learn from your mistake, and just remember that persons are just there to help you, guide you, and don't feel as though they're trying to tear you down because they make a remark, or they have a certain tone or something like that when they're talking with you. All right, so I do hope that these tips will be beneficial for you, and I do hope you will have a wonderful time when you're starting out your new job. And if you have any questions or concerns, feel free to reach out to me. I can answer a few questions, or leave it in the comment box below as well. Other nurses will be on the platform that is able to answer, or even if they're not nurses, there are always questions that other persons are able to provide a little bit of insight into, so feel free to go ahead and leave in the comment box below any concerns or any questions that you have as it relates to nursing, travel, and lifestyle.